121. Which of the following activities are performed by the EMT paramedic in the field? Maintaining and preparing emergency care equipment and supplies. Directing and coordinating patient transport by selecting the best methods. Assigning priorities of emergency treatment. Initiating and continuing emergency treatment. A1, 2, B2, 3, C1, 3, 4, D1, 2, 3, 4.
Answer. Deach, all of the activities are related to the practice of the paramedic. 122. Which of the following statements about care of a near-drowning victim is correct? A. The Heimlich maneuver should be used to clear the airway. B. A ventilation should not be provided until the patient is clear of the water. C. The patient should be admitted to the hospital for observation. D. Near-drowning victims seldom experience head or neck injury. Answer. C. Due to the chance of post-event pulmonary edema, all near-drowning victims should be admitted to the hospital for observation. 123. Which of the following are the signs and symptoms of air embolism? A. Pruritus, skin pallor and cyanosis, pitting edema in the ankles. B. Sharp chest pain with sudden onset, dyspnea with coughing. C. Dizziness, auditory and vestibular disturbances, headache. D. Fatigue, pain in chest and lower abdomen, nausea and vomiting. Answer. Beach, all other options list signs and symptoms of decompression sickness. Only choice B includes signs of air embolism, sharp chest pain with sudden onset, dyspnea with coughing. 124. You are interviewing a 43-year-old woman with a long history of schizophrenia. She appears to try to cooperate, but there are long periods of silence in your conversation while she listens to her voices. How should you respond during her silence? A. Repeat your last question. B. Restate her last response. C. Remain quietly attentive. D. Tell an interesting story. Answer. C. During silences, remain relaxed and attentive and wait to hear what the patient has to say. This will encourage the patient to talk. 125. A patient with bipolar disorder usually suffers from which of the following? A. Frequent hallucinations. B. Delusional behavior. C. Wide mood swings. D. Psychotic thoughts. Answer. C. The patient with bipolar disorder, manic depressive disorder, suffers from wide mood swings from euphoria to debilitating depression. Answer questions 126 to 128 on the basis of the following information. You respond to a 12-year-old male who is wheezing and having difficulty breathing. The patient has a long history of asthma and states that he used his inhaler, but that it didn't help much. Upon examina_X0002_Tyen, you discover that the patient is tachycardic and tachypneic with a non-productive cough. 126. What is the primary goal in treating this patient? A. Correct hypoxia, reverse bronchospasms, and decrease inflammation. B. Decrease respiratory drive, decrease heart rate, and increase blood pressure. C. Increase heart rate, decrease respiratory rate, and correct carbon dioxide levels. D. Correct carbon dioxide levels, decrease inflammation, and increase heart rate. Answer. A. The goal with this asthma patient would be to correct hypoxia, reverse bronchospasms, and decrease inflammation. 127. This patient's condition might have been triggered by any of the following except A. Warm air. B. Allergens. C. Exercise. D. Medications. Answer. A. Cold air, not warm air, is a common trigger for asthma. Choices B, C, and D are also triggers. 128. Treatment for this patient includes which of the following medications? A. Versed, epinephrine and diazepam. B. Albuterol, aminophylline and atropine. C. Albuterol, terbutaline and steroids. D. Terbutaline, steroids and verapamil. Answer. C. Albuterol, terbutaline and or steroids are commonly used in the treatment of asthma. 129. Diazepam and lorazepam are examples of which of the following? A. Antipsychotics. B. Phenothiazines. C. Tricyclic antidepressants. D. Benzodiazepines. Answer. D. Diazepam, Valium, and lorazepam, Ativan are benzodiazepines, which have sedative effects and are prescribed for patients who suffer from acute anxiety attacks. 130. Starting in 4 on an alert patient who refuses 1 could result in your being held liable for which of the following? A. Assault. B. Battery. C. Libel. D. Slander. Answer. B. Battery is the unlawful touching of an individual without consent. Assault is the threat of bodily harm. Libel is saying something that is not true. 131. A 5-year-old male has multiple injuries in various stages of healing, including raccoon eyes and a new suspected broken leg. On questioning, his mother states that he fell out of his bunk bed, but his sister, age 9, says that Daddy beat him. The mother insists that her husband will take the child to the hospital when he gets home from work. How should you proceed? A. Document your findings, convince the mother that transport to the hospital is necessary, and report your suspicions of child abuse. B. Make sure his condition is stable, grant the mother's request for delayed transport, and follow up that evening to confirm that treatment was sought. C. Confront the mother with your suspicions, transport the child immediately, and call the police. D. Remove both children from the home immediately and transport both of them to the hospital for a complete evaluation. Answer. A. In cases of suspected child abuse, your responsibility is to ensure that the patient receives necessary care immediately and report your findings. 132. Until ruled out by a physician, documented fever in an infant younger than 3 months old is always considered to result from which of the following? A. Epilepsy. B. Reye's syndrome. C. Epiglottitis. D. Meningitis. Answer. D. Fever in a child younger than 3 months old is considered to be meningitis unless proven otherwise. Transport all infants with fever promptly. Epinephrine and nebulized albuterol. C. Airway maintenance and administration of humidified oxygen. D. Administration of bronchodilators and corticosteroids. Answer. C. Management of epiglottitis consists of airway maintenance, oxygen, and prompt transport. Answer questions 134 to 138 on the basis of the following information. You respond to the residence of a 4-year-old male who is found in his backyard, head down in a 5-gallon bucket of water. The child, according to the mother, was in the water for approximately 4 minutes. The child is cyanotic, pulseless, and apneic. The ECG shows he is in asystole. The child weighs approximately 40 pounds. 134. A physician at the scene of an incident instructs you to provide care for a patient that you know to be inappropriate given the patient's present condition. Your best course of action will be to A. Contact the medical control physician and ask him to speak with the on-scene physician. B. Inform the on-scene physician that you disagree with his instructions and ask him to perform the procedures himself. C. Politely inform the physician that his instructions are inappropriate and ask him to leave the room. D. Ignore the on-scene physician's order, load the patient in the ambulance as quickly as possible, and transport rapidly to the hospital. Answer. A. The medical control physician should be able to engage with the on-scene physician in discussion with the patient's condition, the level of care that will be provided by the EMS personnel, and the transportation destination decision. 135. Which of the following would be the most reliable method for determining the proper medication dosing for this pediatric patient? A. Give no more than 1/2 the adult dose for all medications. B. Give 1/3 the adult dose for all medications except atropine. C. Use the Broslow tape or another length-weight measuring system. D. Estimate the patient's kilogram weight by dividing by 2.2. Answer. C. Using the Broslow tape or another length-weight measuring system is the most appropriate way to determine proper medication for a pediatric patient. 136. All of the following medications can be given through the endotracheal tube to pediatric patients except A. Lidocaine. B. Epinephrine. C. Atropine. D. Valium. Answer. D. Valium is usually given orally or rectally. 137. After endotracheal intubation of this patient, which of the following steps should be done first? A. Confirm the ETT placement. B. Inflate the cuff to prevent air leakage. C. Dilute all ETT medication to 10 cubic centimeters. D. Tape the tube to the patient's maxilla. Answer. A. Your first step following placement of the ET tube is to confirm its placement in the trachea. After confirmation of placement, secure the tube with tape or using a commercial device to help prevent dislodging of the tube. Pay especially close attention to these tubes as they are easily displaced, even when secured. Depending upon which size tube you use, it may or may not be a cuffed tube. Medication administration will follow after confirmation of placement and securing the tube. 138. After the first round of ACLS drugs, the patient converts to a sinus bradycardia at a rate of 40 beats per minute. What is the drug of choice for managing this patient's bradycardia? A. Epinephrine. B. Atropine. C. Isoproterenol. D. Dobutamine. Answer. B's epinephrine is indicated for pediatric bradycardia in this situation. 139. Knee injuries and hip dislocations that occur during a motor vehicle crash are often the result of which pathway of energy transfer? A. Down and under. B. Down and back. C. Up and over. D. Up and back. Answer. A. During a frontal crash, the down and under pathway causes the knees to strike the lower dashboard violently, causing the described injury pattern. 140. A high-velocity bullet passes through the body. Besides the direct damage caused by the bullet, what other related condition could cause harm to the patient? A. The type of metal used to make the bullet. B. The internal opening created by cavitation. C. The gunpowder residue. D. The length of the bullet. Answer. B's cavitation caused by the pressure wave of the bullet's forces creates both temporary and permanent openings within the tissues. Tremendous forces are transferred from the velocity of the bullet to the tissues, causing damage.